where we are trained, we remain ourselves. We remain indissoluble. We remain unsoluble just for us to make our mark, put our mark on the sand of times, and then we're able to move forward in all spheres, in all dynamics. I have said it, Professor Saidu Lawal today, who is our guest speaker, is Professor of Avian Medicine, is a class of 87. I am class of 87. Avon, class of former registrar, class of 87. Professor Morenike, first female dean of any faculty in Federal Republic, Faculty of Vet Medicine, Federal Republic of 87. Federal Republic of Nigeria, class of 87. Abonyi, Godwin Abonyi, former MVMA president, class of 87. Charles Ibe, former MVMA president, class of 87. UK Sandabe, the first vice chancellor of University of Borne State University, class of 87. So a lot of class of 87. Alabi, Nero Alabi, one of the former chief veterinary officer of Federal Republic of Nigeria, class of 87, handed over to Memuna Habib, this class of 87. So we have a lot of class of 87. But what I'm saying here is that if you are trying to overtake us, try to have what it takes, to take what it takes to overtake us. So that is all. And today we have Professor Saidu from Ahmadu Bello University and Professor Chuka Ezema, University of Nigeria. Ezema will moderate Lawal Saidu. And what we are trying to do in this space is to see how we soften the interfaculty walls in faculties of veterinary medicine in Nigeria so that they can cohere and reaching out and be on the same research pathway. Because, I mean, being a lecturer is being a researcher. And then we will cut across geography, cut across gender, cut across age bracket. You see a granddaughter, like when Professor Tomori was moderating Dr. Amaka, you know, Professor Junaidu moderating Ezendoka. That is what the spirit why we are here. We are here to see how we can put our heads together as a club, as a unit, as a research unit, and in fact, as a corporate unit in all spheres of human endeavor, so that we'll be able to build the character and content in us, expand our character and content, and do the best. And that was it. So please, Chukwuezema, please start.
Thank you, Chief Ibe. I'm happy to be here. Coincidentally, unfortunately, I've worked with Professor Lawal without meeting each other. Some 2 years ago, two of us to fellowship students.
Okay.
And so it's somebody I've worked with without meeting. So I'm glad to be here. And the topic is very germane. Poultry diseases common in Harmattan season in Nigeria. And this is just the Harmattan season. So I think it's a topic that will many people will benefit from. And it will be most interesting. So, Professor Lawal, you are very much welcome, and you can take on the floor.
Thank you, sir.
Yeah.
Well, I'm happy to be here. I've been to UNN about 2 or 3 times. My friend was there, but unfortunately he died this year. Nwata, may his soul rest in peace.
Amen.
And you are the former dean too, and my mentor is there. The IBD man. I forgot his name due to old age. The IBD man.
Okay. Professor J. Okoye.
Okoye.
Yes.
Okoye has been my mentor, and he examined my PhD, and I've learned a lot from him, and my good friend is also there.
He's still very much around.
Hello?
Professor Okoye is very much around, though retired.
He's very much retired, but he told me he was appointed Professor Emeritus.
Yeah, he is. Yes.
And so and quite a number of people.
He's our Professor Emeritus.
Yes, he is. So we'll start. The topic is poultry diseases common in Harmattan. When we say Harmattan.
Sorry, Prof. Please kindly put it on a slideshow, Prof. Put your slide on a slideshow.
Okay, I know see with me.
Click new slide. Click new slide.
Okay.
That slide ahead, that slideshow, you put it on the slideshow. Only this page will be showing us, not the whole entire.
Okay.
Are you fantastic?
Are you okay now?
Fantastic.
Yes.
Better.
Are you okay now?
Yes.
It's okay. It's okay now.
Very well.
So when we say Harmattan, what do we mean by Harmattan? Charles Ibe, if not because he has been living in Kaduna, he will not know Harmattan. But those of us living in Sokoto, Kano, Kaduna, Maiduguri know what it is Harmattan. It is a season characterized by extreme low temperature, sometimes below 15 degrees or even below 10 degrees in some years. And it's a season characterized by dust. It's very dusty, windy, and dusty. Therefore, if you have a season that is cold, windy, and dusty, you expect to see more of respiratory diseases. And this season, fortunately for layers, particularly of the layers the farmers like Harmattan. For what reason? Their layers lay very well during this season. And they have, but they don't know that if these temperatures are lower than 10 degrees, the birds will suffer also from what we call cold stress. So yes, chickens will give you more egg, but the stress can be a source of concern. And then the temperature differ between day and night. If you say Harmattan diseases, there are many, very many, very many. But we'll pick a few. We'll start with the viral diseases. We'll start with the common one. The common one we all know. The common one we all know. Is Newcastle disease, which is very common, which is known in almost all villages in the country. In fact, you have a name for the disease in almost all tribes of Nigeria because it comes annually and usually during the dry Harmattan period. We in the villages when we were young, we liked the Harmattan period because that is season when we eat chicken and eat chicken and eat chicken tired. We didn't know what our parents were losing. But it's a disease that is very common all over Nigeria, and it is endemic, and is a very devastating disease, particularly in local chickens. Why it is devastating in local chickens is because they are naive. In most cases, no history of vaccinations, little or no veterinary intervention. Therefore, annually when it comes, the new birds that have been hatched in between the Harmattans, it will wipe most of them out. And then you find people have to start all over again after the Harmattan season. One very bad thing about this disease is it doesn't respect age. All ages are susceptible. chicks, adults, and even old birds. Another problem with the disease is almost all species of birds are susceptible. Over 250 this species or genera of birds are susceptible. So you can see almost all birds are susceptible to Newcastle disease. Before the advent of avian influenza in 2006 in Nigeria, you can say it is the most important poultry disease in Nigeria. It is the most important cause of losses to the farmers, and it's a major problem too to broilers. Broilers, particularly broilers, because if they are stunted in growth due to Newcastle disease and mortality is high, the farmer will lose a lot of money. In fact, somebody sometime reported to my clinic crying that all her chickens are dying, that she sold her gold to start the broiler business, and all the broilers were dying. And she was crying because the birds were affected by Newcastle disease. So we ended up two patients, the chickens and the farmer, because the farmer was psychologically disturbed that she's losing her investment. She sold all her gold to start the business, and then the chickens are dying. This is what Newcastle disease can do for you. But as a farmer, how can you recognize that your chickens are suffering from Newcastle disease? First of all, the common one is you see them with greenish diarrhea. Farmers will come and tell you that their chickens are passing out greenish diarrhea. Then as the disease progresses within the flock, particularly if the flock is naive, what I mean by naive flock is a flock without history of Newcastle disease vaccination. So as disease progresses within the flock, then you start seeing coughing, the birds start coughing, sneezing, and then gasping for air, as if they want to suffocate, they want air. And then thereafter, after all the coughing, the gasping, you may see facial swelling. You see the sinuses and the eyes, the wattles, and the comb are swollen, highly swollen. In fact, this can mislead young veterinarians and farmers to say they are either dealing with infectious coryza or avian influenza, because these signs, you also see them in these diseases. But you see severe facial swelling, particularly in young broilers and birds without history of Newcastle disease vaccination. Then as disease progresses, you see tremors, you see nervous signs, you see the bird stretching its leg, the wings will be dropped. In fact, somebody will tell you that by the time you see the nervous signs, the birds are recovering. The disease is getting over. So if you have seen the greenish feces, the nervous signs, coughing and sneezing, and your veterinarian has diagnosed or suspected Newcastle disease, what will you do as a farmer? What will you do? So I think okay. Can we still talk on the epidemiology, sir, or we go straight
you talk on that. Yes, talk on
that. Okay. The etiology of the disease. The etiology of the disease is Newcastle disease virus, which is a member of paramyxo virus group, and there are several of them. But the disease is transmitted mainly by aerosol, but it can be transmitted by contact. It can also be transmitted by ingestion. If chickens peck on dead chicken, like we do in the village, if the chicken dies, we just go and throw it on the dustbin, and other local chickens will go and peck on that one. They will feed on it. They will get Newcastle disease. But the Harmattan wind, because the Harmattan season is windy, the Harmattan wind also aid in the transmission of the virus. So because if the bugs are, you have nasal discharges, ocular discharges, these discharges are laden with the virus. You have a lot of the virus, and the Harmattan wind will play a very important role in the transmission of the disease. But one very good thing about the virus is there are several species, and not all species are virulent. Not all species will give you very high mortality. Not all species will kill your birds. Some of the species are mild, some are intermediate, and it is these intermediate species that are used to produce vaccines against the Newcastle disease. And nobody want to get his birds to get infected with the velogenic, viscerotrophic Newcastle disease. What I mean is the highly pathogenic form of the Newcastle disease. Is very devastating. It can kill all your birds. But as I said earlier on, if your birds, your veterinarian diagnosed Newcastle disease in your farm, if Newcastle disease is diagnosed in your farm, what will you do? What will you do? How are you going to control the situation? The first thing is, if for any reason Newcastle is diagnosed or suspected in your farm, is to try as much as possible to prevent the disease from spreading to neighboring farms or from spreading within the flock. If you can do that, fine. Then there is no treatment. But as a trained veterinarian or as a farmer, you cannot watch your birds dying and say, yes, there is no treatment, I will do nothing. No. You give the birds supportive treatment. You use multivitamins and electrolytes. This will boost the immunity of the birds so that they can be able to fight the virus, and some of them may survive. You can also use antibiotics. I don't want to call any names so that people will not accuse me of advertising for a particular company. But you can use antibiotic. This one will prevent secondary bacterial infection because some bacteria will be lacking. They will be hiding. They will be waiting for stress. And viral infection will lower the immunity, particularly in Newcastle disease. And then the secondary bacteria will become active. Then again, some people are insisting you can call the boss. But if you call the boss to reduce your losses, you may be encouraging the spread of the virus, just like we do it. If birds are sick in the village, they will send them to the market, live bird market, and then innocent people will buy them with the intention of rearing, and before you know it, they will set fire to their houses because the new bird will come in already infected, and it will infect other birds. And then again, as a farmer, where after your veterinarian has recommended the treatment, it is now the onus now lies on your veterinarian to report the disease to the nearest veterinary authority, because the disease is a reportable disease. So the veterinarian knows what I mean. It's his responsibility to report to the higher authorities, who will report to the higher authorities up to the level of the OIE. We are very careless when it comes to disease reporting, but it's very important we imbibe this culture of reporting disease.
Has it crashed out? Lawal, unmute yourself now. Lawal muted himself. Lawal, you muted yourself.
That ocular vaccination. Pardon?
Yeah, you muted yourself a bit, so we lost you in the last 1 minute.
Did I?
Yes.
Okay, I will recast.
Yeah, recast, please.
So prevention strategy. Prevention strategy.
Yes.
How do you? Are you with me now?
Yes, yes.
How do you prevent Newcastle disease? How did you prevent it from your farm, your environment? And I said it's a disease that can be controlled by vaccination. And there are several vaccines for Newcastle disease. And then the vaccines are given at strategic time in the life of the bird. The first one you give is the intraocular. This is usually given by the hatcheries. You give it through eye drop, or if it's possible, you put your birds in a vacuum room and spray the vaccine. But whatever system you use is a vaccine that we call intraocular, is very mild, and it will be the first line of defense for your birds against Newcastle disease. The birds may be carrying maternal antibodies. The mother might have passed the antibodies to the chicks, but all the same, you give them the Newcastle disease intraocular, it will be the first line of defense against Newcastle disease. The other vaccine you use against Newcastle disease is when you give birds at about 3 weeks, 4 weeks, or 6 weeks, depending on the vaccination schedule you follow. And this vaccine is very popular, Lasota, Newcastle disease vaccine Lasota. In fact, somebody call it Panadol because farmers use it as if they are using antibiotics, particularly those that keep layers. So now, you give Lasota after intraocular. Even if you miss the intraocular vaccination, you can still give your birds Newcastle disease vaccine Lasota. Newcastle disease vaccine Lasota is usually given in water, but you can choose to even give it by injection or intraocular. The veterinarians will understand what I mean. But the main route is you give it by water, and is usually given in birds above 3 weeks and above. Now, if you give your birds this vaccine, it will prime them against the next one you are going to use. And I will use layman's language, which is hotter than the Lasota. So now you will use NDV Komarov. This one is usually given to birds usually older than 6 weeks. So you see, if you are dealing with broilers, you may not need to give them Komarov, because by the time they are 5, 6 weeks, they are ready for market. But those of us keeping layers and parent stock, you need to give them NDV Komarov. This at 6 weeks. As some people, instead of giving Komarov, they will use Lasota. Unfortunately for us, if you don't use Komarov in this environment, you may run into problem with Newcastle disease in your farm, because the circulating viruses around this environment are found to be stronger. Let me again use this word. Are found to be stronger and more violent than the Lasota. So Lasota cannot prevent the velogenic infection by velogenic viruses. So you can't avoid using Komarov in this environment that is highly endemic for Newcastle disease. So after you use Komarov at 6 weeks, you go ahead and repeat the same vaccine in breeders and layers at 16 or 18 weeks before they start producing. Most of us use 2-in-1 or 3-in-1. The 3-in-1 is Komarov and this one, egg drop syndrome. The 3-in-1 is Komarov, egg drop syndrome, and infectious bronchitis. Whichever one you give at 16 weeks. And then thereafter, you repeat after each 3 months if you have layers or breeders. Thereafter, you repeat after 3 months if you have layers or breeders. The reason why somebody call it Panadol is anytime farmers see drop in egg production, they will go ahead and give the chickens Lasota. Anytime they see drop in egg production, they will go and give the chickens Lasota. It's not okay because you may end up over vaccinating the birds. And then when you need to really vaccinate them, you may run into problem. So that's why somebody call it Lasota. Then the other one is implementation of biosecurity. When you are discussing biosecurity, it's a very big topic, very wide. We can spend the whole day discussing it. But the main essence of biosecurity is to prevent the entry of offending organisms into your farm. So your farm should be secured, gate, you restrict entry, you don't borrow crates, you feed bags and others you don't share. And people like me that are coming to vaccinate the chickens, when we are in the farm, we should follow the protocol that will prevent us from carrying one disease from the other. So it's a very wide topic, but biosecurity is very important. Then if you talk of sanitation, disinfection, and quarantine, they are all part of biosecurity. Quarantine is very important, where people are buying sources from birds from different sources, or the rich ones among us. We want to keep, we have a layer farm, but we want to keep geese, we want to keep ostrich, we want to keep emu, and we want to keep so many things. So the new birds you are coming, instead of taking them to your farm straight, you have to find a place to quarantine them, to keep them until your veterinarian certifies that, yes, you can now take them into your farm. This is very important. We may discuss it in the next disease we are going to look at it. My moderator, I hope I'm not talking too much.
No, continue.
Okay, thank you, sir. Okay, I've discussed the vaccination. So I've discussed the vaccination. I've discussed the biosecurity too. Then the next disease is avian influenza. The next disease is avian influenza. In Kano, a very funny Hausa man described it as the major general of all poultry diseases. And we ask him
Hello, Prof. Hello, Prof.
I'm with you, sir.
Hello, Prof.
Yes.
I'm with you, sir.
Hello, Prof.
I'm with you, sir.
Prof, please, before we go into avian influenza, can you tell us more about diagnosis of Newcastle disease? The diagnosis.
Well, I really don't want to go into the diagnosis, but I will discuss the diagnosis briefly.
Okay.
Are you with me, sir?
Yes.
Yeah, I'm with you.
The diagnosis, to properly diagnose Newcastle disease, the history, clinical science, and then you perform postmortem examination. If you do postmortem examinations, there are lesions you will see in the trachea, in the GI tract of the birds, in the reproductive tract, depending on the age of the birds, that guide you that this may be Newcastle disease. You suspect Newcastle disease based on the clinical sign, the postmortem lesions, and the history. Then if you want to go further, you can do what we call viral isolation. If you have the facilities in embryonated chicken egg, you can also let me go to the you can also look at the intracerebral pathogenicity index. You can also look at the intravenous pathogenicity index. You can do what is now saving us, PCR. Once you do RT-PCR, reverse transcription polymerase chain reaction, once the genetic material is there, you can successfully say is Newcastle disease. And now it has been very simple. If you submit your samples in the lab, you can get result maximum within 2 days. They will give you your result, either positive or negative. If you don't want to go all this way, you can also use serology. You take the blood. In the blood, you do HI test. It can tell you the amount of antibodies in the system, and you can do HA test. That will give you the amount of antigen in the blood, and then you can do the ELISA, which is more sensitive and more reliable, but a little bit more expensive than the other ones. So what I'm saying is, you can diagnose by serology, viral isolation, and then you can go molecular. Sir, have I briefly solved the problem?
Yeah, continue.
Okay. As I've started saying, the next disease is avian influenza, and in one of the Kano villages, a village man described it as the major general of all diseases. And when we asked him why, he said this one, why he calls this major general of all diseases, is it kills all birds. It didn't respect species. Because for Newcastle, according to him, the dogs are not affected. They survived, but this one doesn't respect anything. He kills anybody. So that is why he calls it major general of all diseases. Why this disease becomes the most important disease is it because it is highly devastating for farmers, and it has great public health risk. But why is it a Harmattan disease? Because the virus survive under very low temperature. Under very low temperature conditions, Newcastle avian influenza virus likes very low temperature. And then the Harmattan wind also helps in the spread of the disease. And then during our Harmattan here, winter is setting in Europe. The European birds usually migrate down to Africa here, although we'll be in Harmattan in the cold season, but the temperature is still higher, much higher than the winter you have in Europe. So these factors, because currently now, as we are talking, because Europe is in winter, there is almost all European countries are reporting outbreak of avian influenza now. Almost all of them. In fact, in some countries, they are experiencing the disease in birds that have history of avian influenza vaccination. In vaccinated flocks, particularly in France, in a flock of vaccinated dogs, they reported outbreak of the avian influenza. So if you go back to history, in 2006, in Nigeria, the disease was confirmed around March. Most of us at that time were baffled that this is a disease of cold season. This is a disease of winter. Why is it around in March? But it happens like that because we are very slow in diagnosing and backtracking the birds. Around December of 2006 also, birds were dying mysteriously in Jigawa State. They don't know what was killing the birds. They don't know. And then from Jigawa, you know how we trade our chickens. And before you know it, it reached Kano. Before you know it, it reached Kaduna, where it met the Wakawas and Co. And they decipher it, and then and it took quite some time before it was diagnosed in March also. And before that time, a lot of damage has been done. A lot of chickens have been moved from the north to the south, southeast, and the whole country was on fire when it comes to poultry production, poultry consumption, feed consumption. The whole industry, poultry industry, was reduced to nothing in 2006, early 2007, due to avian influenza. So it's a serious disease, and the worst part is, as I said, is it can affect human beings, and the life of one human being, you can't quantify it to the life of 1 million chickens. So all the world effort is to prevent the disease from getting to the human beings. So etiology of avian influenza. What is causing avian influenza? It is caused by a virus, the avian influenza virus, particularly the A, because there are several A, B, C. The A is the one that is common in chicken, and it was classified into, you have two types of the disease. You have the highly pathogenic and the low pathogenic avian influenza. The Harmattan season is really influencing the disease. As I said, it is windy and it is dusty. So the wind assists in the transmission of the disease. The virus is spread through direct contact with infected birds, contaminated environment, and then the most important one, airborne. When people ask a retired professor of poultry medicine, that can they get avian influenza by eating an infected chicken? He said no, except they are going to eat the chicken through their nose. But if they are going to eat the chicken through their mouth, they cannot get infected. He's not encouraging them, but the chances are highly low that you get it through ingestion, but mainly airborne, particularly in human beings, and is more devastating in young chicks. So what are the clinical signs of avian influenza? How do you see? I always tell farmers, if you see unusual high mortality that is not responsive to your treatment, you better run to the nearest veterinarian, because the disease is characterized by an unusual high mortality that is increasing by the day and that is not responsive to your treatment. So if you see that as a farmer, the first thing to do is to run to your nearest veterinarian and report your observations, and then he will take over. But you see the following signs: the respiratory distress. You see respiratory distress, you will see coughing, you will see sneezing, and you will see also gasping. Then you may see, if they are able to survive long, you may see nervous signs. You will see paralysis. You will see them turning their head as they do in Newcastle disease. And then you may see, not only drop in avian influenza, not only drop in production, you see cessation of egg production from whatever number to zero. And then the birds will become so much inactive that they become speech, no noise, as if you are in cemetery. If you enter your poultry pen, they used to cackle. They used to cackle, and then when they are cackling, they are giving you money. But you will see cessation. You will see no activity. The place will be quiet, as if you are the pen will be quiet, as if you are in a cemetery. And then after that, you see sudden death, very high mortality that is not responsive to treatment. One very trick with the disease is if your birds are on cage, the mortality you see is not similar to the ones you see when you have birds on the floor. When you have birds on the floor, yes, it will come within 2-3 days. It will wipe the flock. But if they are on cage, you see one cell will die today, then another cell will be infected, then it will move to another cell, and depending on how many tiers of cage you have, it will be moving gradually from one cell to another, from one tier to another, and then it will deceive you that you may not be dealing with avian influenza, but it may really be avian influenza. But this is the highly pathogenic avian influenza. Mr. Moderator, permit me to say one or two things about the low pathogenic avian influenza. Apart from the highly pathogenic avian influenza, which we described, there is another one they call low pathogenic avian influenza. This one will give you the picture as if you are dealing with Newcastle disease in a vaccinated flock. You have low mortality, you have drop in egg production, you may have mild or no respiratory signs, and the mortality rate will not be more than 15 to 30%. And you see farmers pumping a lot of antibiotics, pumping a lot of Lasota into the chickens. And thank God, we are happy now. We have so many labs that can give us results to say, yes, it is either Newcastle or avian influenza. Around December 2010, we had a very big problem in Zaria. A farm reported high mortality, and we visited the farm. We suspected highly pathogenic avian influenza. Unfortunately for us, when we sent samples to this Kaduna lab, or lab, after the diagnosis, they reported that we were dealing with H5N1 and is it H9N2 also, the low pathogenic avian influenza. So we had mixed infection. Why I brought this up is, yes, you may have mixed infection with the low and highly pathogenic avian influenza. But the veterinarians among us should know that both low and highly pathogenic avian influenza are reportable diseases. Thank you, Mr. Moderator. So as we have said all this one, and then the zoonotic potential of avian influenza is what I may say a little. It affects human beings, and as I said earlier on, the life of one person is worth more than 1 million. You can't even compare it with the life of chicken. And it's very important for us to know that in 2006 to 2007, most people affected with avian influenza in low-income countries such as Egypt, Cambodia, Indonesia, most of them died. So for those of us that are in public health, they will tell you that the case fatality is high. So why I'm saying this is because we still, despite avian influenza, we are still sleeping with our chickens in our bedroom up here. And it's very important for us to know this, that the case, if 50 people are affected, you are likely going to lose 30 people due to the disease out of the 50 or even more. So we have to be extra careful. Again, here too, people have to be extra careful when keeping poultry and pigs, particularly poultry and pigs, because there is hardly any poultry farm you visit, you will not see ducks, you will not see ostrich, you will not see cow, you will not see goat, you will not see sheep, and in some cases you see pigs. So when you are mixing the two, you have to be extra careful, because it can be a very problem for all of us. Then before we discuss on management of the disease, a moderator wants me to discuss diagnosis. Diagnosis of the disease, avian influenza, is very tricky, but we'll handle it. The first thing the farmer will come to your clinic complaining. The first thing the farmer will see is an unusual high mortality that is increasing on daily basis and not responsive to your treatment. Then once you see that as a farmer, the first thing is to report to your veterinarians. And then as a veterinarian, if you go, you see cyanosis of the comb, cyanosis of the wattle. You will also see facial swelling. But one very good thing with avian influenza is you also see hemorrhages in the legs, hemorrhages in the legs, the hemorrhages in the legs of the chickens. Unfortunately, we saw an outbreak in a broiler farm with very high mortality, with hemorrhages in the leg. When we submitted samples, to our dismay, the diagnosis was Newcastle disease. So one thing is, it is very difficult based on clinical signs and post-mortem lesions for you to differentiate between Newcastle disease and avian influenza. So after that one, when you do that one, you do post-mortem examination. You have to be extra careful not to get infected. And there are lesions you see that will prompt you to suspect it is avian influenza. Now, for avian influenza, unlike Newcastle disease, you cannot do viral isolation, because you need a high biosecurity lab. Your lab must not be below level 2. They categorize the lab based on the level of precautions they take. So avian influenza isolation, for now in the world, I don't know. It can only be done in Padova, where you have the International Avian Influenza Laboratory. But in labs like the NBRI, which is a regional lab for avian influenza, is serving the whole of West Africa, you can do rapid diagnosis of AI by agar gel pre-spitting test. You can also do what we rely heavily on is the molecular diagnosis. Once you do RT-PCR and it is positive, the bands are there, you can conclusively conclude that it is avian. For you to say, sir, moderator, am I on the right track?
Yes, yeah, you continue.
For you to say it is H1, H5, blah blah, you have to send to reference laboratory. But how do you manage the case? You can't manage this case. The first thing is you report to the nearest veterinarian, who on open suspicion of the disease will report to higher authorities. While he reported to higher authorities, they will take samples to the lab, particularly to NBRI, for the laboratory diagnosis. And once they confirm it is positive, for now, because is to call all the birds, to quarantine all the farm, and then the farmer may or may not be paid compensation. Now that compensation is becoming a problem, prevention strategy. Now that compensation is becoming a problem, several governments all over the world are away from compensations because the resources are dwindling. Now people are emphasizing on vaccination. For Nigeria, we are still on do not vaccinate. Yes, do not vaccinate. But throughout the 8 years of the former regime, I think nobody got compensation. And they came up later and say if you lose less than 3,000 birds, nobody will pay you compensation. So farmers in Nigeria are smuggling vaccines against avian influenza and vaccinating
No. Let's go.
and vaccinating their birds in order to curtail their losses. In fact, I read an article where some people assess the quality of some smuggled vaccines. So since people are importing these vaccines and the money for compensations are not there, and all over the world people are imbibing vaccination, there may be a need for us to revisit that no vaccination law and allow control vaccination. A lot of us that are conservatives that believe on the no vaccination thing to prevent the disease in the country are being forced to really revisit the issue because farmers are losing money. And if you are not compensating, some people will end up committing suicide. And it's safer for your farmer to remain in business and alive. Even if he has lost, if he's alive, he can continue with the business. But one very important fact is, even if we are going to invite vaccination, as I've said, even France, they have reported this year, I cannot remember the date, but they have reported outbreak of avian influenza in a flock of ducks that had been vaccinated. In fact, two flocks. One flock was vaccinated once, the other flock was vaccinated twice, and they had outbreak of avian influenza. So even if we are going to vaccinate, even if we are going to invite vaccination, the authorities must be up and doing to make sure we are using the right vaccine. The vaccine is being conducted by the right people. The problem with avian influenza is you have several types, and cross protection may or may not be there. Then apart from vaccination, the other thing we can do on the farm is biosecurity. Strict biosecurity. As I said for Newcastle, no visitors. You have get to the farm. No wild birds. You cannot prevent them. It's very difficult. And as much as possible, people like me doing vaccination from one farm to the other should be forced to follow the recommended protocol. And monitoring and surveillance, this is the duty of the authorities. Unfortunately for us in Nigeria, we are sleeping because after the 2006 problem, there was surveillance, active surveillance, because it was during the, is it active or passive? I cannot, if it was 2006 active, and thereafter it may be passive. There was surveillance, and then up to now there is nothing. And I think this one is the duty of the authorities, not the farmers or not the veterinarians. The veterinarians will do it, but if they are directed by the authorities. We have discussed this infection restricted personal protective equipment. Yes, personal, it is the farmer that during the outbreak, those of us that are involved in calling the boss, we need the protective attire. But all this is the responsibility of the government. Then take away from here is as I said earlier on, it is a problem for the birds and it is a problem for human beings. We don't want it to get to the human beings. So, and we don't want it in the birds as much as possible. And that is why the veterinary authorities in Nigeria and elsewhere are up and doing to control the disease and limit it to the birds, and so that we protect the generality of human population. Then secondly, strict biosecurity measure. This one is the responsibility of all farmers. In fact, it's easier to spend 1,000 naira to protect 5,000 naira than to come to spend 10,000 naira trying to protect 5,000 naira. What do I mean? If you, it's a common saying that prevention is better than cure. So if you act fast, if you are proactive with your biosecurity and other things, you can prevent the outbreak of the disease in your farm. In fact, it was very funny. Somebody had outbreak of avian influenza in the farm, and in a particular pen, and he started spraying the whole farm in an effort to prevent the disease from getting to the other farm. And then third one is very important: synergy between we, the veterinarians, the farmers, and the government agencies. And as I said, reporting of the disease. This is very important, where the government agencies report to higher authorities, surveillance, and other logistic supports to the farmers and to the veterinarians. I hope, moderator, I'm not off.
No, continue.
Okay, sir. Thank you, sir. Aha. Now we have finished the big two. These are the major problems for us during the Harmattan period. These are major causes of loss to the farmers. Unfortunately, the first one, the Newcastle disease, will give you money, and avian influenza, you and the farmer will be running away from the farm. Everybody trying to prevent himself from being infected. But Newcastle will give you money. But we are now going to discuss another disease, which is infectious bronchitis, which is a highly contagious disease of chickens primarily. It affects chickens primarily. Other species like pigeon, pheasants can also get infected. And it is called by a coronavirus, not the COVID-19, but it belongs to the same class with the COVID-19. Infectious bronchitis virus is a coronavirus. The problem with the disease is there are several serotypes. So Chief will agree with me that is very difficult to control by vaccination. You have to combine several polyvalent vaccines, several vaccines. You can expatiate on that one, and is characterized by coughing and sneezing, and it is spread by what? By aerosol. And another problem with the disease is it can linger for weeks or even months in a flock, depending on the age of the birds. Then what are the clinical signs? As I said earlier on, gasping, coughing, nasal discharges. You have tracheal, then you have depression in weight gain. Then you have drop in egg production. This one, if layers are affected, you have drop in egg production. The quality of the egg is also affected. You have soft shell eggs, misshapen egg. In fact, some of the eggs, there will be no albumin. Different shapes of eggs. The quality of the egg is compromised. And then if you have breeders like the chief used to have, it will reduce your hatchability. The hatchability of your eggs will be highly reduced. And for a breeder, if he cannot hatch, then he may be operating at a loss. Once you have reduced hatchability, even if your fertility is excellent, once your chicks cannot come out, or they come out wet, then you have problem in making money. And then, as I say, since the embryo will die, certainly it will affect the hatchability. Before you control the disease, this is another disease that is very difficult to differentiate from Newcastle disease, also based on clinical science and even the postmortem lesions is very difficult to control from Newcastle. So mostly we rely on viral isolation, and we also rely on, currently now we are becoming lazy. We rely on molecular diagnosis, because this will give you confirmatory diagnosis. Another problem we have with the disease is most of us have not reported clinical infectious bronchitis in chickens in Nigeria. Even if there are reports, the reports are very few. But it will surprise you that this same disease, the virus, has been isolated in Ibadan by late or day, and somebody Oluwayelu too has isolated the virus recently in Kano. So it has been isolated in Ibadan. The virus has been isolated in Kano. And then there are serological evidence of this disease in Zaria. There are serological evidence of this disease in Sokoto and several other places. But yet, we still continue to pretend that the disease is not a problem in Nigeria. So, Chief, it's over to you. You have to find a way of yes, really, is this disease there? But it has been isolated, as I said, in Ibadan, in Kano, by several workers, and in Zaria we have serological evidence of the disease. So it is very much around with us. And the best control measure is by vaccination. And in broilers, you can vaccinate 1 or 2 times. In layers and breeders, you vaccinate 2 or 3 times. After you have done that one 2 or 3 times for layers and breeders, and then you also repeat vaccination every 3 months, like you do for Newcastle disease. One very good thing is, with infectious bronchitis, you have it sometimes with Lasota and infectious bronchitis for use in broilers. As I said earlier on at the beginning of the class, you have at the beginning of the talk, you have you have it in combination with egg drop syndrome, and you have it in egg drop syndrome and Komoro. So the vaccines are available, but some authorities will tell you you may need more than one strain of the vaccine for effective control of the disease. I think the Massachusetts strain, or whichever, is the commonest one we use to vaccinate chickens. Then again, the normal biosecurity, as I said, is a very big one. Is a very big. Chief, can I continue? It's already after.
No, continue.
Then you have biosecurity, as we said, is a big topic, but to reduce the entry of the organism into your farm, some people will insist you don't keep multi-age birds in the farm. But for those of us looking for money, you cannot stop us from keeping multi-age birds in the farm. But whatever you do, you can compartmentalize the farm. You have the section for the chicks growers and then the ones that are giving you the money. Another one, okay, we are coming to an end. Please bear with me. You know, Chief gave me a very big topic, so it's very difficult. Chief, I don't like long talk.
Don't worry. Don't worry. Continue.
I'm worried.
No, from today you start liking long talk. Don't worry. I promise you that one.
Yeah. Okay. The other one is infectious coryza, which is this one is so much for the viral diseases. This one is a bacterial disease. It also is usually in the Harmattan period, and it is very important for you to understand the clinical signs, the cause, and management strategies to maintain healthy and productive flock. It's very important to do that. So, what are the clinical signs of this disease? As we said, for all viral diseases we have discussed so far, for all respiratory diseases, you have thick mucus discharge. This one is thicker. If one has common cold, you will see light, very thin mucus discharge, very light. But if it is infected by bacterial co-infection, it will become very thick and in some cases green. That's what you see. Thick mucus like discharge from the nostrils, of the birds. And then certainly if the nostrils are blocked, you will also see sneezing and you see difficulty in breathing. And then as we have discussed for the Newcastle thing, as we have discussed for the avian influenza, you will also the waters and comb may become swollen. They may become highly swollen, and they may become discolored. Discolored in this meaning they may be brown, they will be bluish, just like you see in avian influenza. And then you see naturally if somebody is sick, you will not eat. So you see decreased appetite, and then there will be loss of weight, and then there will be loss in egg production. I don't know. We used to call this one Gallinarium. That's what we used to call it. But now they have given it a name, Avibacterium Paragallinarium, which has the respiratory tract as the predilection site. The dry, dusty conditions of the Harmattan exacerbate and encourage the spread of the bacteria, making the birds more susceptible to infection. The transmission is mainly through direct contact with infected birds or contaminated whatever, and inhalation of dust particles containing the pathogen. Now, how do you diagnose the disease? As I said, for other diseases, it's mainly by clinical signs. You do postmortem examination, you see additions, and then you take samples. Here you take samples, and you can isolate the bacteria. If you don't want to go to postmortem level, you can take a tracheal swab, and you can isolate the bacterial organism from the swab. It's not like our avian influenza or Newcastle disease. You can easily, anywhere you have microbiology lab, you can isolate this organism. And then And then how do you prevent this condition? Before the prevention is a disease you can easily treat. Once you have very good antibiotics, you can easily treat it. Sometimes you find it not responding to common antibiotics, and you may be forced to use what the farmers don't like, drugs that will cause drop in egg production. But it's a disease you can easily treat. It is treatable. You can easily treat it. So before you have prevention, you can easily treat it. And then prevention, the best prevention strategy is you vaccinate the birds against infectious coryza. Our only problem is the vaccines are not readily available. And if you see them, they are very, very expensive. Very expensive. So most farmers are reluctant to spend a lot of money in buying the infectious coryza vaccine. But vaccination is really helpful. Vaccination, if coupled with biosecurity, and you have high nutrition and clean environment, then you will be in business. Monitoring and surveillance, this one is for us. This one is for the authorities. The farmers the farmers have very low role to play here. This one, there is no problem. Biosecurity measures and everybody knows what we mean by this. So with this one, sir, with this one, sir, I hope I have done justice to the disease. One cannot all the Harmattan diseases. We try to pick the most serious ones. I hope any shortcomings during the discussion time, and we will continue to discuss the conditions. They are highly relevant, and I like the chief. I want to thank the chief for choosing this topic. Is right on time, and is what our farmers need. And so, to the moderator, I avoided the diagnosis and other things because I thought our emphasis should be the farmers. What you do, what the farmers will see, what the farmers will do. It's not addressed to our colleagues, but thank you for correcting.
Don't worry, for veterinarians, we will have a special session with you. Just don't worry.
Yes, sir.
We'll have special sessions with you.
I appreciate that one, sir.
Yes, so that we can deal with some intricacies of it.
Yes,
I know where you're heading to.
Yes,
just avoid quackery. That's it. But that's okay. You did justice to it. And Professor Ezama will react to what you've said. Then I have some statements to make, just expand on the topic. And then, because you mentioned my name several times,
because you are chief.
You mentioned me several times. Just don't worry. Poultry is our line. Poultry is where I've been trained. Poultry is where I practice. Poultry, I had a farm until bandits pursued me out of the farm. I've done poultry on various value chain. I've done broiler. I've done parent stock. I've done commercial layer stock. So I lived with it at Angwarimi GRA, where I kept those breeders at least. There's some level I had 5,000 birds laying behind my house in Angwarimi GRA. So I mean, what you said, you are very strong, and that's why you're here. Professor Ezama, please react to it so I can. There's some issues I need to raise with you. Thank you.
Yeah, thank you, Chief. Thank you, Professor Saidu.
Thank you, sir.
Of course, I know you, and I wasn't expecting anything less.
Thank you, sir.
We must appreciate you for your detailed exposition of the vital diseases.
Thank you, sir.
Whenever kept, you know that you can avoid everything, but none is becoming these days.
Thank you.
And well, like you rightly said, we may have to change our approach. Initially, we said no vaccination,
yes,
but
sir.
since government don't want to commit money to compensate farmers,
yes,
I think it will not be fair to say don't vaccinate and you can't compensate.
Yes.
I'm aware of a farmer somewhere in Delta State that lost more than 100,000 layers.
Yes.
Incidentally, he, as at 2-3 years ago, he was the president of the Poultry Farmers Association. And as at 2 years ago, he has got not one kobo. Okay. So we don't have an option other than to now encourage people to vaccinate. The only danger is that, you know, what you use as vaccine today, because of the character of the virus, yes, the ability to mutate in the next 5-6 years, what you use as a virulent strain could become very virulent. So I think we need to do more work to identify how often we may need to repeat the vaccination to keep the birds safe. I thank you for mentioning the other ones. They may not be, you see, they're not that they're not common, but our problem, our handicap is lack of identification. We have not, they may be living with us, but we have not been able to diagnose them. And I also know that most of our participants, from what I've seen, are veterinarians. That's why I dragged you to diagnosis, because that's will be their interest.
No, some farmers.
Although the chief has said that. Okay.
Some farmers are
So
here.
thank you very much.
We will bring him one day to deal with vets. Don't worry.
Vet, okay.
Yes.
Okay. Thank you, Prof, for doing justice to the topic. And I think I will, before the chief summarizes, it may be good to leave the forum open for questions.
Exactly.
I think that some people may have questions to ask so that Prof can shed more light.
Okay, sir.
Yeah.
Thank you very much.
Thank you, sir.
So those that have comments, please, or you can raise your electronic hand, make your call. You can on the chat box.
Also, we have a question from the chat box from Dr. Joseph.
Okay.
He asked, Prof, a very educative presentation.
Prof, remove your screen. Remove your screen. We are okay with it.
Remove yes. His question is that when is best to vaccinate for infectious coryza? From Dr. Joseph.
You see, let me take it on. Infectious coryza has a lot of strengths and have a lot of strengths and a lot of types, serotypes, and then pathotypes. It depends on the strain. You don't just vaccinate. It depends on strain in the country, and that's where we are querying the VOM and all our research bodies to give us a data bank of strains of these diseases in the country. You might chasing a wrong one, but some vaccines had compressed, a lot of strains together. But work on manufacturer's specifications. That's it. Work on the manufacturer's specification and mostly work on your biosecurities. But Lawal can add and make up from this. Please, Lawal can add. Yeah.
But the vaccination for infectious
coryza.
coryza.
Yes.
It's a very difficult one, as you have said. But for me personally, I used to do it before my boss reached 10 weeks. I always do it between 8 and 9 weeks. Doc, have I responded to the question?
Yeah, you are doing well. Yes. Because the vaccine is very strong.
Yes,
if you try it from 6 weeks, you might get some mortality. It's a very, very strong. In fact, when you vaccinate your birds and you come there, you see high morbidity, not mortality. You see high morbidity, almost 80% morbidity of the stress of the vaccines on those birds, even at 8 weeks. So, I think it's 8 weeks is manufacturer specification. This between 8 and 12 weeks. But if you try to do behind, I bet you are going to see a lot of mortality. So, but the morbidity on older birds are high, but mortality is very, very low. But the morbidity is high. They all recover. And most times, make sure you prepare yourself with vitamin, amino acids, and strong protein diet that can take off the effect of those stress after the vaccination. It's not a vaccine you give and go to bed. And then you give this vaccine IM. At the end of the day, your water tap is not, the line is blocked somewhere. They're not taking water immediately after the vaccination, or something which we have seen in several times. Some water line can be blocked. So it's a thing that you test all your water lines, for those of you who are using water lines. Or some of you who are using the mechanical, the manual ones, should make sure that your workers are on the ground to give them water. And minerals, vitamins, amino acids dissolved in water. Next year, we are coming up with a lot of products in poultry sector. A lot. We are coming up with the heat stress. We are coming up with heat stress and normal stress. We're coming up, let me not just say it, but gradually we're going to move into the market. Because what we're trying to do is that by the time we finish packing all the knowledge we got in here, it will give us a direction of which products we'll bring into Nigeria. We don't just bring products for bringing sake, confuse people. No, we bring products for the environment, what we have seen, so that we can move the poultry industry forward. We are not foreigners that come here, destroy the industry and run away. Give us 5% methionine lysine and label it 99.5. We don't have any place to run to apart from our country. So that is why we want to do things and do it very well to sustain the industry. Because the industry will even employ our colleagues more if it is well sustained. So that's the thing. Lawal, you can continue from here. Lawal, do you have anything to add? And any question, please. I must say, stop that your phone call. Stop your phone call. Mute yourself and take on this.
Take calls now.
Please. Please unmute yourself. You are a co-moderator here. You're a co-host here. Nobody calls you till we finish this business. We call him. Yeah. Any other question from the tarmac?
Yes.
So for somebody that said, as Pajok that has talked about time frame, I think the minimum is 8 weeks. The maximum is 12 weeks. That's from what Prof is saying. And he has reasons for saying that, which I've expatiated. Then, if there's any other question, but if there's not, I have 1 or 2 points I want to raise. Yes. Then before we can call it a day.
Chief, I think you can go on.
Yeah. Yes. Because one. He mentioned that people always vaccinate and revaccinate, which is true with Lasota. which is true. It's just that we don't have a controlled system in the country. But let me just move to IB. IB is in the country. I have seen it clinically, but fortunately, I have not seen the respiratory form of it. But we're talking about the other forms of it, like the misshapen eggs you see. You've said some area of eggs will be depressed, some will be up, some will be down, and then lose shell. I would say partial lose shell, and then the urate. That's another good. Getting to the urinary tract and seeing a lot of urate. We have seen all this, but the only thing that we have not seen the explosive clinical sign. I don't know what is suppressing it here. Maybe because it's a coronavirus, it's an envelope virus that are very fragile. And they're not so explosive. Maybe I don't know why. We've seen shapen eggs, we've seen urates, we've seen all manner of stuff, but we've not seen acute respiratory form of the disease in the country. So that's, I mean, it's a like Professor Saidu said, the antigenicity is so pleomorphic. We have many antigenic strengths that works in their silos and in their compartments. I think Lawal should confirm this. They work in various compartments. And that's why we are calling, let's have an antigenic data bank. And then we'll be able to know which antigens we are dealing with. So that if you are bringing vaccines, if you're vaccinating, then you know the vaccines you are giving. Most of the things we are doing in this country are very wrong. Because of ignorance. Professor Saidu, are you hearing me?
I'm with you.
I'm
with you, sir.
You have over 6 strains of IC. Okay, at least 4 I know of infectious coryza.
Okay.
And then you have some vaccines that have all those 4. You have some that has one, that have 1. You have some that have 2. You have 3. And they antigenically they're not correlated.
Yes.
The same thing with IB. Not like foot and mouth disease in cattle. Yes. So please, most times we are wrongly diverted. Now, there's another. You see, one thing about Newcastle is that it's a graded step-by-step immunity. So the time you get hyper-immunity. By the time the birds have started laying, in fact, shortly before the birds, they should have got the immune level supposed to be very high. But you don't place the strongest strengths at the bottom of your vaccination schedule. Because if you place it, sometimes you might get artificial infection, induced infection. That's why it's graded. It's saying about IO, that's subconjunctival a means of vaccination. If you use the strongest strain for that subconjunctiva, it might damage the eyes. So you use very mild strain, that's B1, Lasota, before you get to Kumorov, because if you start with Kumorov, as you are going, because these things are milder, strong, the immunity is being graded to a level of hyperimmunity. That's what we call staircase immunity. But at the point of you see, there are times immunity. That's why I want to ask Saidu what this question. At the point, especially heat stress, there are some environment the immunity wanes a bit. You start, in fact, what the first thing you start noticing is the colorization of the egg. More especially if you're not using, for those that have brown eggs, you start having decolorization. That means it's not that it's coming to full-blown clinical status. It's trying to tell you that if you waste your time, you might get to, because the vaccination has been graded, you might have, and then you might have partial immunity, not strong immunity that can control the clinical status. Then what do you do, Professor Saidu, at that point? Because there's one thing we found out and we're doing that really has helped. What do you do?
Before I say anything, I want Professor Usman to chip in here before I answer. Professor Usman.
Usman of Sokoto.
Yeah. Hello, sir.
Yes.
Good.
We want to see your face, sir.
Okay, my face. I have been showing it.
Yes.
Yes. Yes.
Uh-huh.
So just goodwill messages. Prof, you have done well, and you have, in fact, the lecture I will say is self-explanatory, and that's why maybe we're having fewer questions, but very interesting topic, and all the aspects that people have learned something about them, including us. And coming back to Ochendo of is it Okrika or Akrika, I don't know.
Okay, can I second hand
So
plate?
the moderator can correct me. The moderator can correct me. Is it Okrika or
Okay, can you say a second hand clothes? So I'm not second hand clothes.
Yes.
Professor Usman, Chief
Yes,
is Ochendo of Okija.
Okay, sir.
Correction
taken, sir.
Yeah.
Yes. Okay, sir. Correction taken.
Akrika Ochendo for Okija, not
okay,
Okija.
Akrika Ochendo. I've got it right now.
Okrika is second hand.
So, sir, about the vaccination actually with Newcastle, mostly in the field. If you wait till that 3 months, actually all the clinical manifestation will appear. If you wait till that 3 months as recommended. I think even at Borne, they recommended up to 3 months, 12 weeks. And by the time a farmer said that he wants to follow that, you'll find that the other issue like Dr. Ibe was saying, discoloration of eggs, small size eggs, shellless, and other things may start coming up. The mortality may not be there, but all other things. And you know, one thing with the farmers, anything that will affect their egg production, in fact, they don't like it and they don't joke with it. So sometimes if you wait till the cycle of vaccination do that, I think one thing we may not notice may be the level of titer. Even if it is protective titer as recommended by OIE, is there if you analyze the serum, you find that you may still have some of those clinical signs, despite that the titer serologically is a protective level. So that's why you see some farmers opt for 6 weeks or 8 weeks revaccination with Lasota, which I don't think, which from my little experience I had, I have not seen any negative effect with that, depending on the type of Lasota you are using. Because some companies also, you find that the Lasota is more stronger than the other companies. I don't know what is there. But depending on the type of Lasota, if you wait some time till that 3 months, definitely all those signs will start manifesting. Though you may not, you have little or no mortality, but all those signs that may affect a production will be there. So I think I will leave the rest for the professor to expatiate.
You have said everything. Chief, I think our chief.
Yes.
Are you with me, Chief?
Oh,
our only way out is to monitor the titer of the birds before vaccination.
Already vaccinating, yes.
Yes, before the vaccination. Because we have to educate the farmers and us that there are several causes of drop in egg sizes that will cause small size eggs and other things. So for you, the safest way out is to monitor the birds before vaccination. In fact, a farmer in Abuja, very big farm, premium farm, maybe if I'm premium farm, what we did was to establish a lab, and we have a laser machine, and we monitor the titer of the birds, and it's based on that whether we revaccinate or not revaccinate. But not all farmers can afford this.
Professor Lawal, you are talking from somebody that is operating at elitist platform. There's some of us in the field that don't even need those ELIASA or whatever you're talking about. Before you know, you agree big farms. I know one big farm I forced that farm to establish a in-house laboratory so that they can monitor the titer level and then be shooting up the titer. But some of us in the field where you don't have, all we notice is what we notice, like he mentioned, Usman mentioned, once we notice the eggs trying to, what's very in Harmattan period, you start seeing the eggs start decolorized. So that before you know it, you are going down the drain of immunity. And that's what we call waning of immunity. And another time we normally see it, especially, during the Harmattan, like you say, is blown by dust. In fact, the dust is the primary agent. The wind is secondary agent. Because, the dust is the primary agent. They sit on the dust and being blown by the wind in the dust. And you see, it says, like you said, it's the cold wind from the Mediterranean world, from Europe, as it's passing through Sahara Desert. It carries a lot of dust. And so that's it. And then during the heat, this stress, the immunity wanes. There are a lot of forces that make the, but as when you are living with chicken, there are certain things that you see that is embedded in you, that is characterized in you. Once you start seeing that decolorization as a certain component, like these factors I said, I mean, there are a lot of things that can decolorize eggs. If you use soya beans that partially prepared, your eggs are going to decolorize. There's a lot of one or two things, but you are monitoring the time. But in soya beans is that every egg. It's not, but in Newcastle is that it's coming gradually. So, there are a lot of things, mechanisms you need to put in place for you to be thoughtful and say, this is the way you are going. And once, what we do in my own farm, when I was there, once we see that decolorization and we vaccinate, especially with Lasota, the eggs are coming back. That means you are doing a right job. And one thing I see, vaccination schedule for those in the west and east cannot be the same with Newcastle with the same in the north. Arid zones where there are epidemiological forces that are more epidemiological forces that are driving Newcastle disease. So you need to work under a seasoned physician in an environment, either by, as you see, there are things people like me, I do. Any question you ask me, it won't take 1 naira from me. I will give you the answers. Because the sky is limit for everybody. If you are starting this practice, make sure you, even if you are starting on your own, make sure you clean yourself that people that are well versed in that environment, in what you are pursuing, they will teach you, they will guide you. But unfortunately, some older vets will tell you, bring those clients to me or refer them to me. It's not every problem that is beyond your power, competence that you refer. Please be asking questions, the consulting books, be reading. We started practice an analog phase where we read books, we subscribe to magazine. There's something he said here, how to vaccinate young birds. Sorry, how to vaccinate village birds. There was this, in fact, one time took up on it to more. I was in Napri. I went there to do 1 or 2 things. They had just come out from a seminar, and Professor Umo was reasoning loud. How can we catch village bird, chicken, and fowl and start vaccinating them? Fortunately, that was the time Poultry International sent me one poultry magazine because I was subscribing to it. Sent me where they are vaccinating. They are vaccinating in Thailand village birds with heat-resistant vaccines, and then impregnating it in rice husk or grain husk, and we're throwing it to them, and they're eating early in the morning in small doses. So I told Omo about that. I said I should give him that. One said, okay, asked me whether I know Dr. That was my first time meeting him. Whether I know then Dr. Wanta. I said yes. He said, okay, he was going to send one to my house. I sent that into him. It was through that his letter informed the PhD thesis for Dr. Wanta, late Professor Wanta. So you see, Nigeria should look at those research and see whether they can have thermo-resistant strain of Newcastle disease vaccine, how they can produce it. And I will tell you, Komarov is thermo-resistant. That one I know, because there's something happened. They took light for some times and I used Komarov, which if you try it with other strength, it will not work. I'm not talking about other Komarov, I'm talking about von Komarov. But I want Lawal to respond to all this. Then, but I don't say you should use Komarov to produce vaccine. So because if you try it, we know what we're going to get. Anyway, as Lawal is responding to this, and then we can be able to pick up one or two things and trash before we.
Chief, before Professor Lawal responds.
Yes.
Chief.
Yes.
I said before Professor Lawal responds, there are two things I want to highlight. One is a point you made. You know, there is about vaccination in the north and vaccination in the south. You know, there is a positive correlation between immunity and ambient temperature. Those in the north that are always enjoying very high temperature, 40 degrees and above sometimes, their immune system are more threatened than those in the south that have 30, 35. So it's a scientific fact that they are more prone to depressed immunity. The second thing I want to highlight is the point made by Professor Usman. Yes, you waiting for 3 months may put a farmer in trouble, except if you are using oil immersion Lasota. If you vaccinate with oil immersion, you can rest for 3 months. Brilliant. But if it's ordinary Lasota, if you wait for 3 months, you might be embarrassed.
Very true. And that brings us to a point that the bio vaccine should be part of your vaccination schedule.
Yes.
Especially 6 and 16 weeks. It should be part of your vaccination schedule. Let's get on. And you don't vaccinate birds, please, that is laying with a Komarov.
No.
But if you try it, your production must crash.
You
must crash. So let's take this. But with oil vaccines, because oil vaccines are dead vaccines. So the gra-gra is gone because they clip the gra-gra before they use it, and they impregnate it in oil and stuff like that. So please, oil vaccine. But another thing is, if you are using oil vaccine, you know, this one is beyond the field. The titer level must be monitored because some of the oil vaccines are not. Agreed. Newcastle has universal antigen. That one we know. But one thing is that if you are doing it, I hope you are doing the right thing. But for those who have the power to do the right thing, make sure you monitor your titer level. Not vaccines are vaccines. From what I have seen so far.
Not all vaccines are vaccines.
All vaccines are, they have messed up the dog industry in Nigeria by bringing in wrong vaccines, and parvo is classically parvo is all over the places. Not vaccines are vaccines. But if you have the right oil vaccine, please, and then inform, I don't know what I will tell them. They're supposed to have a very strong quality control. Their vaccines are up and down. At times you get the best of it. At times you might run into the wrong batch. Anyway, let's continue.
Okay, sir. I think, sir, let's take it this way. Even under the best storage conditions, vaccines lose their titer. and it has been proven that you can keep vaccines on the shelf for some time and they will still be viable. Our major problem with the kill vaccines, using the kill vaccines to revaccinate, are two. One, the cost of the vaccine. Two, the farmers find it very expensive to pay for the labor. But otherwise, killed Lasota is the best. You vaccinate your horse with killed Lasota, your layers, you can go and sleep for 3 months, even more, no problem. But if you use the local vaccines, as the moderator has pointed out, up north here, the high temperature will definitely encourage the decay of your antibodies. And if your antibodies are decaying, you cannot wait for 3 months. So to be on the safer side is to encourage farmers to use their empirical knowledge, because farmers are very good researchers. What they have been observing and the actions they have been taking and the results they have been getting. If within 1 month their eggs are becoming white and smaller, nothing will stop them from repeating Lasota on monthly basis. But the danger is if you are repeating Lasota, that's why somebody called it Panadol. Because farmers use it because you cannot use continental chickens always.
No,
So
no.
you are over challenging the system, and you will not get the response you do. Sometimes another problem is our method of administering the vaccines. I have layers, 10,000 on cage, 50, and then I want to vaccinate them using the tick dose. That is 10 mils per bird. By the time you do that and you serve them, before the vaccine get to the last cell of the it will be finished. So we have to look at modify our system of administering vaccines. Once we do that, we will be in business. With the thermostable vaccines, Chief, I think Professor Usman is the best person to answer to respond to this one.
Which one? Which one?
Professor Usman.
Okay, Usman, please. Oh,
sorry, sir.
And they were producing I2 vaccines, and he has done his master with the I2 vaccines, as Nwata has done. And in fact, we have used several vehicles to deliver the I2 vaccines to the bird. So I think I should throw more light here.
No, thank you, sir. Actually, in relation to thermostable Newcastle vaccine I2OB4,
yes,
several trials have been conducted in Nigeria and elsewhere.
Yes.
And I think I will say the research continues because the best one we found so far is using a parboiled rice. And I think giving rice to the chicken is something with the At my own angle, actually, we tried it, delivering it with the sorghum, late Olabo, the former provost of College of Medical Lab Sciences in Borne. We tried the husk guinea corn, and we found appreciable results. We used so many things, even using delivering it through the coated, using Gone Arabic, included in Gone Arabic, and coated with the grains. Several trials have been conducted, but the result is still in progress. We didn't reach the perfect vehicle for delivery for now for using thermostable vaccine. I think other universities at Ensuka and other things, I think that I come across some few that have conducted research on that and other things. So still research continues in Nigeria as far as I'm concerned, even elsewhere. But the one, as I said earlier, that was very established is the use of parboiled rice. And in Nigeria, parboiled rice is beyond the reach of the people. So that's what I can say.
I think the research should continue because the epileptic power supply and under indices might bring down or might have been bringing down the potency of our vaccines.
No, what I'm saying to say, Chief, if you use it alone, we are thinking of easier way of delivering that vaccine to the rural chickens.
Yes.
And in fact, if we are using like use Lasota in drinking water or in eye drop, it works perfectly very well. And I know some communities in Plateau State and around part of the Kaduna that use it very, very well. If I share in Sokoto with among near the Niger Republic, I push that vaccine and the people have found it very, very useful. But the issue now, we still cannot stop us using conventional vaccine. The thing we want found either a method that the farmers can easily deliver it to their chickens. And the only way we can do is only by finding suitable vehicle that we can use to deliver vaccine to the chickens. And that's what I'm saying is still going. But in terms of the quality of the vaccine, other things is perfect, working very well. And it's available at MBRI Borne. And I think even at cheaper price, although now I don't know the cost, but it's very available and at cheaper price.
Well, because you need vaccines that you can easily apply. You know, catching chicken and dropping them an eye, just give them food. They will come. If you see that picture in Thailand in the Poultry magazine, you see them as they're dropping the food, the vaccines on those implemented platforms. You see a lot of chicken coming to eat. You don't need to catch one, drop, catch another one.
That is rice based.
Yes. So please.
All right, Prof. Sorry, there is a comment or a complaint on our chat box. I believe it should be a farmer from Poloronso Olusola. Say good morning, our guests and everyone. In my 5 weeks plus broiler, I discovered some of them were getting weak with low appetite. In fact, some of them are started dying, very sluggish in appearance. They wore suit like someone that is feeling cold. What could be the cause and solution to the problem in order not to record mortality, sir? Thank you, our prof and all the facilitators on the program.
Let me say something from my experience. Birds taste buds. Birds taste buds are very, very sensitive. If you give them moldy feed, they might reject it. They would, even if they're dying. It happened to me and my client, Maharia Mohammed. The husband was the Chief Justice then, the Chief Justice of the Federation. That's Mahajia Bello, Mohammed Bello's wife. Happened to, we went and brought one feed at the trade fair in Kaduna, manufactured in Gongola. When I started seeing it, no clinical signs, nothing, but you see morbidity coming down. They were not eating. But these same birds, if you give them bitter pills in drinking water, they will drink. But if you give them moldy feed, they will not touch it, even the lung. And what I did after observation, I didn't see anything is change the feed as my first day. Immediately they changed the feeds to livestock feed, then Pfizer. Piam, they started eating. And as you are eating, I went and recommended one soluble vitamin, mineral, blah, 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 blah. And that solved the problem. So please, check, Mr. Farmer, check your feed. Birds don't dent. Even with it. Once they peck it and it's not good, they won't touch it. And they know their tongues, their taste buds are sensitive to certain set of feed. Sorry. But Professor, I'm just trying to drive my experience to you. But Professor Saidu, please, you can. Lawal.
Chief, you have tried, you have answered, you have solved a problem. My only advice is let her go to the nearest veterinarian. That will come because physically. It may be very difficult.
Yes, because it's the veterinarian that will tell him that these birds that don't have any clinical sign. The only clinical sign that saying having is morbidity. And the woman told me that they will give them food, they will give them feed, and they will not, the feed will remain like that almost. The quantity they were eating was not much. Then I knew. So the first day, in fact, there I nailed my diagnosis. And they changed the feed, and it changed immediately. And once you give them good feed, oh my God. Yes, you see how that hunger that they've been, you see that hunger, just to drop that hunger, you see the speed they will be eating the feed. So that's it.
Yes. I think Chief, the farmer must go to the nearest veterinarian and insist he follows her follows her to the flock and examine the flock, and then give her correct diagnosis and advice. It will be very difficult for us to tell her here that that this is the problem with the boss and this is what he should do, because what she described, by going by that, one would be thinking of IBD, infectious basal disease. And in broadness, it can give you this manifestation, sluggishness, feeling as if they are cold. But as you have said, it may be the fever. It may even be the environment she is keeping the horse. So let us see the nearest veterinarian to the nearest vet.
Brilliant. And that's where I stand too.
Yes. Olusola, are you there? Did you get the point? Did you get the commendation?
Yeah, I think we should be rounding up by now.
Thank you, sir.
Please, I will circulate this video again from YouTube to various platforms. And those who are not in our platform, if you receive it, send it to those who invited. I've seen Saidu Manir Bapa here. You're welcome, sir. I've not. But let me reel out some of people. Dr. Lani Beku has spoken on, it's in that YouTube channel. Dr. Lani Beku has spoken on biosecurity protocol, actually. He spoke a lot on it. Yeah. And one thing I advise farmers on this stretch before I move on is there are some people who are using toe clippers to depict your birds. And they're using toe clippers and moving from farm to farm, carrying disease from farm to farm. And we all know that toe clippers don't have any physical correction to infection. Because if you use the conventional debickers, at least it's being heated and they are killing the virus or the bacteria along the way. But when you use cold what do you call it, toe clippers to debick without disinfecting, and some people who call themselves those who debickers are moving from farm to farm with such a thing, creating disease. And some people are using their what do you call it, their vaccinators from farm to farm without disinfecting. Please, farmers, be watchful. Anyway, I've spoken about Dr. Lani Beku. Professor Caleb Kudi is here. Professor Junaid is here, Fudus. Dr. Nzaku is a deputy director in the Animal Health Department or Division of Ministry of Agriculture. Okay, sorry, Ministry of Livestock Development. And then we have Professor Usman Musa and then Saidu, Professor Ezema. A lot of people are here. Please, you are all welcome. So please, what I will advise you is that all these video, the slides are in the YouTube. I have sent you this link. But if you don't have the link, I will send the video on various channels. So as you are watching, go and watch it again. For those who don't have good network, like Mbafo has reported to me from Cameroon, you watch it and watching it becomes your life pattern. Well, please, it becomes your life pattern. And then remember to subscribe to our YouTube channel. As you subscribe, you share, and then maybe you pass your comment, you like, you notify. It's a way of advancing the algorithm of this hour, because we want to push this to all over the world. And the more you do those things, the more it's pushed all over the world. And the more our content becomes highly containerized. So thank you very much. Professor Zema, thank you. You can see the way we work here. I have
Thank you,
thank
you, Chief.
You can link up with Saidu Lawal. I have his number. Two of you can have research thoughts and come up with research topics.
Yeah.
And let me tell you people one thing, and then let me say it again. I told them in Vom, MVRI Vom, when I held seminar with them, I was their speaker in a seminar. The advice I will give, even the young researchers here, anywhere, try to belong, because being a member of World Poultry Veterinary Association taught me a lot of lessons. At that platform where the world meets, research funds are flying on poultry diseases, poultry medicine, and what have you. You can have collaborators all over the world, but the only thing that, even if it is poster presentation, once they advertise for such conferences, please send your, what do you call it in research?
Abstract.
Yes, send your abstract. If it is accepted, I've met Boala in Edinburgh here some time ago when they held it in Edinburgh. I've seen Oladele in Denver, Colorado, when they held it in Denver, Colorado. Myself and late Bayo and Malgui went for the one in Cairo. Cairo, I think 2002. So at such platform, one, they'll pay your accommodation, they pay your flight ticket because you're educating the world. Then they give you some change. At that forum, you are going to meet a lot of people who are interested in researching with you. You cannot be an indoor person and get an outdoor blessing. I've said it, I made it, that's why I'm very mobile. I move a lot, I gather experience a lot, I gather knowledge a lot. And if you sit, I don't know who is hosting it, in such platform, and you see even people at plenary sessions presenting topics on poultry diseases, advanced poultry diseases, all this is talking about HPI, LPAI. In 2002 in Egypt, it was all over the places. Before the thing struck in Africa, eventually, on World Poultry Veterinary Association. On this, anybody on poultry should belong to World Poultry Veterinary Association. A lot of money by corporate organization, non-state actors, a lot of money flying on research. In fact, there was one question I asked. Shuan Bishop in South Africa came to me and asked me in Cairo, what is there anything we can do together? But unfortunately, I'm a trader. It stopped at that. In Cairo, there are some things I mentioned. Just in plenary session, question you ask, people will pursue you. There you can gather a research team. The money is there. So let's move. So let's move. Malam Saidu, Lawal, is there anything you say here?
Thank you, Chief, for the opportunity, and my moderator and all the participants. It has been an exciting morning that has gone into the afternoon. You have said it all, particularly for the young people. Go out, speak in seminars, especially international seminars and conferences. You meet people, and you go into collaboration with people, and you make a name, and the country will benefit from your name. But if you sit down in there like I'm sitting up, nobody will give you, and you will look for nobody, and you make very little impact. And I hope we will have the opportunity to meet again so that we can educate each other. Thank you very much.
Thank you very much. On this, sorry, we have Samuel Anzaku. I think I don't know whether I mentioned his name. Samuel Anzaku is deputy director in the ministry. I don't know whether I mentioned his name when I was profiling our heads here. Please. Well, I think we are all on our own now. I will stop